Ellen Wellens. I've been a dental hygienist for 21 years.
So how did you first become interested in this career?
I had a degree in kinesiology, and I was graduating and needed a job that could pay. so then I looked into dental hygiene. I have 2 cousins that are hygienists. You either need a bachelor's degree or an associate's. It's about the same 4 years either way, whether you get a bachelor's or an associate's. It's 2 years of prerequisites followed by 2 years of dental hygiene school. Kind of like a nursing degree, like an RN or an LPN. I think all personality traits work as long as you get along with people, and you really have to be a people person because you're working with people all day long, and you need to be able to read them to see if they're in pain or if they're doing fine. And the starting salary right now, right out of school, is $37 to $40 an hour. And growth-wise, you have your bachelor's degree, so you could, potential growth monetarily is just you get a raise usually every year. And then, so you could go back to school because it's a bachelor's program and get your degree to get your dentistry degree or any other master's if you want to grow and make more money in the future. I'm just part-time right now. I have 3 boys, so the great thing about this job is you could work 1 day a week or 4 days a week or 5 days a week, and right now I'm just working 1 day a week, and we work 9-hour days. We get to work early. We go through all of our charts to check people's medications, and then we see 1 patient an hour, and we usually have an hour off for lunch, and then we work till 5 o'clock at night. Benefits, I think the relationships that you build through the years with your patients, and like today I saw a lady who we bought our puppy from, and so you get to be friends with your patients that you see, some of them that you see for a long period of time. Challenges, there hasn't really been a lot until the last year, and that's been interesting with COVID, but we've figured it out and worked through them. And it's been great for family life because you don't have to work full 40 hours a week, and you can find positions. Some people I knew were only working 9 to 2. It's hard to find an office like that, but you know, if that's really what you want, there's always a shortage of hygienists, so you have more ability and more flexibility. I think working with the people and having those conversations all day long, and for the most part you're not talking, but when they come in you talk to them and chat about their health, and they tell you about their lives, and then you clean their teeth. But when you see them every 6 months, you do start to, you look forward to people coming in that you haven't seen for 6 months.
Yeah, and in such a unique way.
Yeah. I think that, and they've been talking about this a long time, but for hygienists that do get their bachelor's degree instead of their associate's degree, there will be more movement as far as moving into a master's degree, and maybe they call them dental nurses. They have them in Australia and New Zealand, and I think that's probably coming here at some point in the future. But hygienists can have their own practice as well. So that's another option. I guess my advice would be to try to get your bachelor's. There's not a lot of programs left that have a bachelor's degree, but Wyoming, Oregon are a couple of the places that still have them, Washington State, just because it gives you more movement. So one of my friends is now a doctor, and she got her bachelor's degree in dental hygiene and had the ability to help pay for her living in the summers.